At the end of care, I do a complete re-screen of the whole body, and so I check both feet and ankles, and the ankle really is more stable with that drawer test. So I think that reflexively we're able to increase tone in the supporting musculature, because muscle, especially in our distal extremities, has a significant interaction with the ligaments. Some of that's through fascial connections or other dense connective tissues. But I noted after I finished screening that, I noted that you have two different knee joints. Okay? This knee extends this far, and then it becomes very stable. Okay? So I get 2 fingers under the heel. This knee, I'm at 3 and then some. I'm not even touching it. So it's almost 4 fingers. Okay, so this knee hyperextends. Now, on the right, if I squeeze the patella, I can squeeze it further and it'll bob forward towards the ceiling. On this side, I can't squeeze it. That retinaculum is very tight. So I can try as I may to squeeze, it doesn't move and my fingers don't indent anymore. What I think is happening is that the distal femur is stuck in posterior glide. And by appearance, that is such. I did screen hip extension, it's normative. Here is a general posterior glide spring test. And I'm able to take up the slack and I'm able to spring it. It's that orthopedic stress test. And on this side, I can't even take up the slack. So now I'm putting twice the force. I'm putting 3 times normative force and not getting any movement. So my treatment plan to make this knee joint more stable and restore that normative movement in the patella and in the femur is to block the lower leg and glide the distal femur forward for 5 minutes. And we had a woman at a seminar in, I think it was in our Coconut Creek, Florida seminar this year. And she had 40 years of patellofemoral pain and had had a simple surgery 40 years ago. And hurt her to walk. She couldn't straighten out the knee fully. She was weak as a kitten. And that's all we did, and she was profoundly better. Still had some degenerative changes, of course, and such, but was immediately dramatically improved. We have that video up on YouTube. So this is fascinating. I thought we should capture that on film, and so we'll go to treatment and see what we can achieve. And it was interesting because when I started working on that knee, you made a spontaneous comment, which was what? Something about your quad?
Well, this left quad has been tight for the last several months at least, and I think it is definitely involved with even the pelvic problems I've been having.
I agree completely. So we'll stop filming and we'll go to treatment.